G'day and welcome back to the channel. So in today's video, I want to try and help you find the missing piece to your plantar fascia pain puzzle. As a physiotherapist, one of the things that I find crucially important to trying to understand why your plantar fascia pain is there is that we can't look at your plantar fasciitis or plantar fasciopathy as a foot problem. Instead, we need to think of your plantar fascia as the structure that isn't tolerating the broader leg environment that it exists within. Because what I find clinically as a physiotherapist is that your plantar fascia is most likely struggling not because the plantar fascia itself is poorly designed or it's a vulnerable structure. It's actually quite the opposite. Instead, something is causing that plantar fascia to be grumpy and unhappy and persistently sore for a lot of you, I'm sure. So what I want to go through in this video is I want to go through a series of exercises that you probably may not be doing to try and improve the function of your lower leg as it pertains to your plantar fascia. But ultimately, it's a consequence of something else, and that something else needs to change if you want that plantar fascia to normalize over time. So getting into things, there are two main concepts that I'd like to throw at you to explore as to how this may be affecting how your plantar fascia feels. The first is how your entire leg is moving and causing you to load up your plantar fascia. The second is what your lower back is doing. Now, both of these things are valid options that I found clinically, that by improving the function of your lower back and your leg mechanics, we can start to better understand which particular thing is causing your plantar fascia to be dysfunctional. So the first is taking a look at how your leg actually functions. And what I find clinically is that we can gain really strong insights into what might be causing your plantar fascia dysfunction by looking at how you squat. And the reason for this is the squat is a great general leg function test. And for a lot of people, if you watch yourself squat in a mirror, you might find that you have the capacity to turn your feet out, or that as you come down, those knees are subtly wanting to cave in towards the midline. Now, what's really important to understand about plantar fascia function is that the plantar fascia is intrinsically linked to the function of the arch of your foot. The idea is that when the arch of your foot is stable and your big toe bends back, there's this effect that happens from the ball of your foot to your heel that tensions up that plantar fascia so that when you're walking and jumping and hopping, your foot becomes a very stable platform to generate force and to move you through the world. But if you have a mechanism throughout your legs that short circuits that entire function, then the way that you're loading up that plantar fascia is ultimately different to what it's looking for over time. And exposure to this mechanic can be something that can lead to that tissue becoming irritated and overloaded perpetually, and it can make it really hard for you to get rid of that dysfunction if you don't change the underlying mechanic. So again, if you find that when you are doing some squats, if you see that your feet want to turn out or that your legs want to cave in, you'll notice that it'll ask the arch itself to collapse along with it. So if you find that you have that mechanism in place while you squat, regardless of how deep you can actually go, then we need to try and reorientate that position and try and get you into a more mechanically stable shape to load up that plantar fascia all the way down where the arch of your foot tends to be. So the first of these exercises is a hip external rotation stretch, which is essentially throwing a leg up and crossing your leg. The reason why this position is really important is because when you're in that squat shape with your feet straight, if you generate that external rotation through your knees without your toes lifting up, you plant your feet and turn your knees out, you should notice that the arch of your foot gets drawn up when your hip externally rotates. But again, if you're missing some of that external rotation, then you're not going to have the capacity to pull your arch up into a good position and ultimately improve the way that you're loading that plantar fascia. So again, a very simple way to do this is if you can just basically cross your leg over the other one. Now, if you find this is hard to get into, you can have your other leg a little bit further out as well, just so it's not as aggressively externally rotating. But the essence of this stretch is that we want you to be up nice and tall. And I'll do the other leg for this. So we want you to be up nice and tall. We're looking for some real tension and some tightness in the heart of your butt cheek. And then the idea here is that we want you to be up as tall as you feel comfortable, and then very gently leaning over the top of your shin. You can have your hands on your leg just so that your back isn't doing much work. And then we can hunt around. You can twist your trunk towards your knee, you can twist your trunk towards your foot, trying to find the angle that best represents your best tightness in this position. And then, as we always try and do with any stretch that we want to effectively do to improve your range of motion quickly, is that once you've found the best version of that stretch for you, we need to tense up that tight spot for 5 to 10 seconds. The days of just holding a stretch and hoping that something changes should absolutely be behind us. Instead, we need to actively tense up that muscle, make it work, work, which gets our brain involved, so that when you stop tensing, it'll physically give thanks to a reflex that occurs. And then instantaneously, you should feel like you can immediately go a little bit further into the stretch than what you could before. And you should ultimately feel that instantaneously, it should be easier for you to keep that knee out. There should be less restriction. It should feel lighter through your hips, which should ultimately improve your general leg mechanics from above, and then make it easier for you to load up your plantar fascia better over time. And then the second mobility drill that may help you improve the way that you're loading your plantar fascia is trying to find a way to mobilize a stiff ankle joint. Now, it's important to, again, say that we're not necessarily trying to mobilize the tissue at the back of the calf, although calf tightness can be a secondary symptom associated with plantar fasciitis or plantar fasciopathy. What we need to do is get underneath that muscular tightness to the deeper joint rustiness that may be accrued over time without us realizing it. Your body's never going to go through your stiffness. It's always going to go around your stiffness and create a compensation at the other end. And again, coming back to our squat shape, if you find that as you squat down, you can only get to a certain point before you run into your ankle stiffness, the only way that your body can go deeper is if it goes in and around that stiffness, ultimately collapsing your arch, changing the way that you load that plantar fascia and setting you up for failure over time. So an easy exercise that we can do here, it's a very, very powerful one. It's called the banded ankle stretch. Again, if you have a band of some sort, we want to place that band just below your ankle joints, the bones of your ankle. We want to stretch it out as far as you feel comfortable, and stepping your other foot out as far as you feel comfortable. But we want to close down that back ankle and hang off that ankle joint, allowing that band to pull back on the ankle joint, biasing some of the capsular stiffness at the back of the ankle. We need to hang it here for 30 seconds, a minute, 2 minutes, whatever it takes for you to feel like that tissue starts to give and starts to accommodate. The other thing which I always need to point out with this exercise is because we're trying to go through some ankle stiffness, don't do the stretch with the band straight behind you in this position. You will ultimately go further in this position, but the whole point of this exercise is to turn those knees out, keep your foot where it is, externally rotate that hip and go through some of that ankle stiffness that your entire leg may be trying to work around, which is ultimately collapsing that arch and causing the plantar fascia to become overloaded, or at least loaded differently than what it's designed for. And then as we did with the hip stretch, what you should hopefully find is that when you squat down again, it should feel easier and lighter and much more comfortable for you to maintain a better shape and to transfer that mechanics down to your plantar fascia. So once you've taken some time to work on some of those potential hip and ankle range of motion deficits, it's important that we can start to retrain the way that we want your leg to move to optimally load up that plantar fascia. And again, because we've used the squat as a really good diagnostic tool, we can practice good squat technique and good squat exercises to hopefully retrain how you load up that plantar fascia as a whole. And a really great way to do this is with a booty band of some sort. Again, any band works. We just want a little bit of resistance. We want to put that band on and just have it above your knees, because what it's going to help us do is it's going to help us create an external rotation need with the squat, because it's going to try and close our knees in. We want those knees to be rotated out as much as we can and strengthen some of the hip musculature at the top here to hold us up in a good position from the top. And again, how I like to dictate this to my patients is we want to make sure that you practice your squats with your feet straight. Before you do anything, we want to make sure that with your feet straight, we want to create that external rotation outwards. We're trying to rotate your knees out as far as you feel you can. You'll notice that your arches will lift up. Again, we don't want you to rotate so much that your toes come off the ground. Keep those big toes down, feet straight, knees rotated out as far as you feel comfortable. And then essentially what we want to do is we want to maintain this shape for as much depth as you feel comfortable and then come back up again. You might find that if you go too low, you may feel like you'll start to deviate around some of those restrictions. So we want to make sure we prioritize those ideas for as long as you can before you feel like you start to compensate. The idea being is that not only will you start to improve the muscular strength and motor control to perform this movement, but if you're clearing up some of the ankle and hip range of motion restrictions, it will naturally become easier and easier to maintain this position the deeper and deeper you go as those restrictions release. But if we can add a band around your knees to really prompt you to physically keep those knees out as much as possible, not only should you feel like your thighs get a good workout, but you should feel like a lot of those hip external rotators in the back and the side of your hips also start to get a really good workout very quickly. And although a lot of this doesn't necessarily seem like it's impacting your plantar fascia, we're trying to create an optimal environment for that plantar fascia to exist within to hopefully take away the need for it to be dysfunctional in the first place. And if you thought that was a little bit left of center, pay attention to this next idea. So as I mentioned right at the top of the video, apart from the way that you load up your plantar fascia via your leg mechanics, the other thing that I find is often missed completely with plantar fascia dysfunction is the role of your lower back. Now, this doesn't necessarily mean that you have to have lower back pain or any obvious lower back dysfunction that you're aware of, but clinically what I find as a physio with my patients is that if you have some lower back joint stiffness that potentially pulls a bit of slack out of the nerves that go down through your leg that either influence or supply that plantar fascia, then there can be another mechanical handbrake on the system that might already be overloaded and annoyed in the first place. So getting into this, essentially what we want to look for is that if you are stiff at the base of your spine, where your lumbar spine inserts into your pelvis, or as we come up through the facet joints or the individual joints of your spine up towards the base of your rib cage at the base of that thoracic spine, the bottom third of your spine has a lot of the nerves and neural connections that form together that go down the back of your leg through the sciatic nerve and a bunch of other different nerves that can impact your plantar fascia function. Take a ball or take a roller of some sort and go hunting around the base of your spine for clues for anything that might be stiff, tight, and restricted. Spend some time freeing it up, and then go and do the things you would normally do and see if your plantar fascia symptoms have changed as a part of a broader, well-rounded plantar fasciitis rehab program. So again, how this looks is we can take a ball, and you can do this standing up against a wall if it feels more comfortable to you. We're going to take the ball, start right down the base of your spine, just off to one side. And again, as we always do on the channel here, we want to go comparing between one side and the other for clues as to which side feels the most restricted. Because ultimately, we're not expecting you to be painful here unless you have lower back pain already. We're looking for stiffness, tightness, and potential tenderness that might indicate where a certain part of your spine isn't functioning normally. If the muscles are tight, if the joints underneath are stiff, you can cause a mechanical chain reaction of events that expresses itself down your leg and can impact your plantar fascia function, potentially how it feels. So again, choose a spot in your back. If it feels stiff, just leave it there, get a sense of how tight and restricted it may be, then compare it to the exact same spot on the other side, making sure that you spend the most time on the spots that feel the most restricted. Again, once you spend a little bit of time here and you hopefully feel like it's resolved or freed up a little bit, then just move the ball up a tiny bit, go looking for the next spot, keep working your way up until you come up towards the base of your rib cage. Find some spots that feel particularly tight and stiff, compare it to the other side, stay here, let the ball press in, allow it to make that tissue free up and accommodate. And then once you spend some time doing that, as I said, please stand up and walk around, recheck your plantar fasciitis, see how those symptoms feel. We're looking for things to feel obviously less painful and less tender straight away, or ultimately feel like things are looser and more comfortable. Now, again, it's important to remember that if you have traditional plantar fasciopathy or plantar fascia dysfunction, you may have some micro tears, you may have some pretty embedded inflammation or something going on in that area, depending on how irritated, dysfunctional, or even injured that tissue might be. So with any of these ideas, improving your leg mechanics or improving your lower back function can't instantly improve the health and healing of that plantar fascia in an instant. But what it's trying to do is improve the way that you load up that tissue to feed some slack back into the area, hopefully improve the way that you've unknowingly been loading that tissue to give it space to feel better faster. And again, what I find clinically, by working on things that aren't necessarily your plantar fascia itself, you can actually change the way your plantar fascia feels very quickly. It can be somewhat instantaneous, where if there's a lot of tension through your back and your sciatic nerve and the neural tissue that goes down to your plantar fascia, feeding some slack back into that plantar fascia may be enough to help your pain resolve relatively quickly. It can help your brain feel less threatened about what's going on, and you might walk away instantly feeling better in some way. But ultimately, we're not just looking for pain relief, although that is clearly something that may be important to you if you've been suffering from plantar fascia dysfunction for a while. Ultimately, what we're trying to do is improve the function of your plantar fascia. But with all that being said, I genuinely hope some of that was helpful and insightful. If any of it was, please let me know in the comments down below. But once again, thank you very much for watching, and I hope to see you next time. Bye.